I'm happy to welcome Steven Bice here today. Steven is the former Director of Emergency Operations for the Centers for Disease Control. He was actually honored when he was in that role for his development of emergency preparedness organizations. And he's part of the leadership team of our own Medical Reserve Corps here on Bainbridge Island. And Steve is going to talk to us a little bit about the state of our world right now as we have had some success in mitigating the pandemic of COVID, and yet we still face a lot of challenges. And then we're also going to talk a little bit about what we know about communications and public health information during a pandemic, thanks in some degree to the pain and suffering we've been through for the last year and a half. So thank you very much, Steven, for joining us today.
Well, you're more than welcome. I appreciate being invited. Thank you. I think I have 9 points that I'd like to go over, but the first is simple. We need to congratulate ourselves, state of Washington, achieving the 70% of citizens that have received at least one dose of vaccine. That we're not terribly unique, but unique enough across the 50 states, and so many can't possibly say that they've even achieved 50%.
And here on Bainbridge, I think we're at 90%. For 12.
Wow.
I have colleagues that say the United States is made of people 60%. If you put epidemiology behind or inspect it a little bit, you see that almost every offering of vaccines ends up about 60% acceptable across the different states. It's due to a variety of different things, which we can get into in a minute. But anyway, I think we deserve to pat ourselves on the back to get 70% having at least one shot is wonderful. I'd also like to talk a little bit about variants. I know everybody has heard the word. It can be confusing, and I'll spend 2 minutes, honestly. Understanding a little virology is going to help you understand what we talk about when we use the word variant. First of all, viruses aren't living things. In other words, they don't eat, they don't sleep, they don't breathe air, they don't digest. They need a host to survive. They can sit around on all manner of surfaces for literally thousands of years. If you examine the sarcophagi in Egypt, you see hepatitis virus, you see smallpox virus still on the surfaces of those mummies. So viruses are very interesting, but they need a host to survive. And the host allows them to really achieve their primary mission, which is to infect living beings. But once a virus enters your body, it reproduces or replicates and spreads internally. And when this happens, you get a cold or the flu or hepatitis or pneumonia. But as the virus spreads, 3 things happen inside of human beings, or apes, or bats: mutations, variants, and possibly strains. A mutation occurs when a virus replicates or reproduces. The end result may, and often does actually, have a different DNA structure, and these differences are called mutations. So a variant, when a host accumulates enough mutations, you may well get a variant or a variation from the original virus. And finally, the word strain. when we scientists prove that a variant has new biological capabilities, it's either more infectious or more deadly, then we label it as a new strain of that virus. So that's the end of Virology 101. But I give it to you and talk about it because we have Delta variant, we have Beta variants, we have Lambda variants in Peru right now. We have Delta Plus variant currently in the world and in the United States. So this virus doesn't mutate as fast as influenza viruses do, but because it is worldwide and concurrent, we're studying it, and there's more data available every day versus we study flu every day too, but the average person doesn't hear about the results of, we found this, we found that. What you do see is, okay, it's time to get your flu shot, and it's made up of different things than it was last year. So there are new strains or mutations or variants in influenza that cause us to change our vaccine formulation. We may well, as a footnote, we may well see what some people call boosters, which is not really what it is, but we may see an annual COVID vaccine, much like we see an annual influenza vaccine. Okay, so there's enough of that. I gave a lecture last week. I have 14 pages on variants, and I won't bore you with it, but I will say that there are currently in the United States, Delta variant accounts for 52% of the new infections in the country. And that's most unfortunate because what it is infecting are people who are not immunized or who have not gotten the vaccine. And these are people who are 20, 30, 40 years old who have refused the vaccine, and they're becoming more ill quicker, and hospitals are seeing an uptake or an increase in the number of patients, and literally the number of patients on ventilators is similar to, not quite as bad yet as it was, let's say, September of last year. Yes, sir.
So when you talk about that, there's obviously a large population. You said, I mean, at the minimum 40%, and in some communities up to 50 or 60% of the population that's not yet vaccinated, though there was vaccine available to anybody who wants it in this country. And they're now getting sick, and the same kinds of pressures in those populations are occurring.
That's correct.
One of the things that I would like to ask about the variant, since the vaccines that we took, those of us who are inoculated, were designed pre-Delta variant. So we're hearing about something called breakthrough infections. Now, while I'm less likely, as I understand it, to get as sick, do these new variants or mutations or strains pose a risk that I could become a carrier, even if I don't myself get very ill from COVID?
Well, yes, the answer is quickly, yes. You could, but let's be careful about the use of the word carrier. You could have the virus with no symptoms. And until you become symptomatic, you wouldn't change your behaviors. So you could go out and be convivial with your friends and hug an old associate that you haven't seen for a year. In that moment, yes, you are carrying the virus and you could spread the virus to that person. But would you be a carrier for a length of time. No. And once you become symptomatic, you're going to see a doctor, because this virus makes you ill enough. You don't just stay at home. You go see a doctor because things start to go haywire.
So I guess one of my questions about this, I know that in California today, they're starting to recommend or require mask wearing in group settings indoors again.
Yeah, Los Angeles.
Here on Bainbridge Island, we're starting to do programs at the senior center and not require masks. And I'm concerned about, given sort of what's going on, whether we should be at least have a drop of caution in the way that we interact with people for this period while we don't have a handle on what's proving to be a continuing threat of the virus.
Well, I think it would be prudent to be cautious. I do believe that gatherings of folks who are vaccinated provides less of a chance of the breakthrough infections you call them, and that's a good euphemism. But I think what we have to, I mean, I guess the complication is everyone wants to get back to normal, quote unquote. I don't believe post-pandemic that normal is going to be what normal was. And I think that we are going to be, I hope actually that we are cautious. We're heading shortly, in other words, September, October, we'll head into a new influenza season. The last.
I have a question.
Okay, yes, ma'am.
You were talking about hugging someone. If you were vaccinated, you might have the variant and you might be a carrier at that moment and you hug someone.
Yes, ma'am.
Well, if that person is vaccinated, would you necessarily give him the variant, or would his vaccination protect him?
Vaccinations do protect us all, okay? So, but the answer to your question is yes, you could transmit the virus to him, this person that I hugged, for example, and he may be asymptomatic for several days, and he may have a very, very, very light infection. That's not quite the right word, but he may come down with the disease but not need hospitalization. Our immunizations so far, Moderna, Pfizer, J&J, they all provide a fairly strong immunization as compared to someone who is not inoculated at all. So you're much better off if you had at least one shot even. But if you've had your 2 doses, then you're probably not going to be, you're not going to be hospitalized, the chances of that. But you could get the infection.
But those chances might be slim.
Slimmer, yes, ma'am.
Slimmer, okay. All right.
Okay. Now, where was I? I think that for the most part, I guess we could talk about immunizations now, at least to underline how effective they actually are. I know there are many people, and unfortunately, the inoculations have been politicized, as have the tests and the virus in general. And so people are cautious, more cautious than perhaps normal, but the virus is such that, in my opinion, it's it's quite foolish not to get immunized. It's quite foolish not to become fully vaccinated. And I say that not only for one's personal health. In other words, if I would caution that it's dangerous for your neighbors, your loved ones as well, if you are not vaccinated. If you listen to virtually anyone who had any family who said, well, we're not going to get vaccinated, and then got the disease, what you'll see is a sad story of, oh my gosh, we never realized it was this bad. And now mothers, daughters, sons, grandparents have become infected in places around the United States where they could have avoided this altogether had they been vaccinated. And many are hospitalized and some are actually passing away. So, and it's unnecessary. It could have been avoided. I'm not saying that the disease could have been avoided, but the hospitalization and the catastrophic end state intubation and oxygen requirements could have been avoided. So in that sense, I just don't understand why folks aren't getting immunized. I know that there are fire departments, police departments who are mandating that their employees, all firefighters, all police, get a vaccine or they will not be employed. And some people think that's quite harsh, that it should be up to the firefighter or the policeman. The problem is that they interface with the public constantly. And I see it as certainly an employer's, in other words, a government saying, in order to interface with people and do your job as a firefighter or a doctor or a police person, yeah, you need to be immunized. It's controversial, I suppose, in some people's minds, but not in mine.
Yeah, here at the senior center, we're requiring people to register their vaccine, their second or final vaccine date with us prior to taking part in activities here, just to try to provide that safety for the other attendees.
I think it's prudent. I know that there are companies out there right now in the state of Washington who are going over this very issue, and some are deciding, well, if you're not immunized, then if you come to work, you're going to have to mask. And some people are saying, well, I don't want a mask and I don't want to get immunized. And there are concerns amongst owners of companies and management in those companies that say, well, you're putting us all at risk. Therefore, we'll have to let you go. We're going to have to come to a reckoning on this issue because it's not going to go away. We might be through with the virus, but the virus is definitely not through with us. So, unfortunately. So we talked about the word booster, but we talked about a yearly vaccination. Masks, social distancing, washing hands. In my opinion, it's still recommended. If we're gathering together in a group, let's say you want to go to the symphony or you want to go see a play, that you're going to be seated next to people. I don't suppose any symphony is going to say, we want to see proof of vaccination before we seat you in aisle 3, seat 5. That may come to pass, but I don't see it. So if you go to that symphony or attend that play, should you wear a mask? My wife and I will. That's you know, I guess I won't go much further than that, but yes. Testing, that's another issue. Why, when we're vaccinated, would we want to get tested? Well, for the most part, you won't need to, but I strongly recommend, if you have any upper respiratory distress, any symptoms at all that you think, oh, gee, this is a cold I'm getting, get tested for coronavirus. You may have a breakthrough infection. You may be one of those very unfortunate few who suffers from the disease. Now, your chances of hospitalization or getting seriously ill are very, very slim, unless you have some sort of contributing coalition factor, such as, you know, heart disease or lung disease or immunosuppressed disorders. Then you could be in difficult shape. So test. My recommendation is, yes, get tested if you have symptoms that you think you may be, oh, this is maybe I'm having an allergy attack, or maybe I'm having just a cold. I strongly suggest you get tested. And there's testing available here on Bainbridge, but there's testing available around the United States. Another point, I talked about the coming flu season. Last couple of seasons, we've had a remarkable success against influenza. And that is to say, the numbers were far different than back in just even 2 years ago. If people are going to throw away their masks and act like it's all over, no more pandemic, then I think we're going to see an uptake in influenza cases, and that, combined with coronavirus infections, could be very difficult for hospitals to handle and to take on. So
get the flu shot for sure this year. And I'm guessing that, you know, like you're talking about when you discuss the use of masks, think about if you're going to be in a public situation, you can use a mask to help reduce the likelihood of you passing on a flu to someone else. And masks like N95s that we were told were not available at the beginning of COVID are certainly available now.
Correct. Yeah, it's a good prevention for you to not get the disease. And should you be unfortunate and have the disease but no symptoms, at least it would keep you from passing on that disease in a crowded situation. So it's you know, we're going to see a lot of concerns coming up in the next 2 or 3 months. Proof of vaccination, vaccine passports, all kinds of different things. Canada says, well, Americans who are fully vaccinated can come across the border. That's an interesting development. How they go about, or what they feel is proof of vaccination. It'll be interesting to see what they think of as proof of vaccination. So I think we'll see more and more of that. There will even be some states, I am convinced of this, when we get into hotspots in a few seconds, I'll talk about that. But I'm convinced that there will be a few states who say, wait a minute, if you're from Nevada, we want to see proof of vaccination before you cross the border. It's such a porous border, I think that's almost silly. I mean, what are they going to have border stops now between states? No, but nonetheless, there could be at least a titular prohibition against some states that have very low vaccination rates and high infection rates with Delta variant from traveling.
Yeah, and we've seen that with Hawaii, for example, being.
Oh, yes. The island states, speaking of island people, are usually very much more concerned and aware of incoming infection because they know they're isolated. They know it can spread much quicker than a state with common borders. So, yes.
So yeah, you were talking, maybe you're going to talk a little bit about hotspots and about areas that are.
Yeah. Right now, the uptake of that 52% infection in Florida, Louisiana, Arkansas, Missouri, and Nevada. That list changes slightly from day to day, but those states are going to stay hotspots for a while because their rate uptake of the vaccine is so very low. So Florida, Louisiana, Arkansas, Missouri, Nevada, the fact that they don't have even 50% of their population vaccinated with one shot, it makes them highly susceptible. And I think their hospitals, I know their hospitals are seeing far more patients, unfortunately, with infections, and these are people who were unimmunized to begin with, so they're much more severe illnesses. So, in a sense, that's it. I was asked the other day, talking to some students, well, what's the difference between a hug and a handshake? It caught me off guard because well, there's obvious differences, I felt like saying, but I held my smart tongue. And I asked, well, what do you mean? Well, is one worse? Can we handshake, or are they the same? And clearly, a hug is more concerning to a physician than a handshake, because you can wash your hands or you can use a sanitizer, and that would stop the transmission of the disease. Whereas a hug, it's much more difficult to sanitize one's entire frame from a hug. So I said, hugs are worse, for what it's worth.
I do remember some advice when in the New York Times when people were asking about hugging their grandkids, and there was if you're hugging them and they're much smaller than you and you aren't breathing in their faces and you're not sustaining a hug, you're probably very, very, very safe. The real issue I think we've learned, you were talking earlier about how vaccine or viruses can live on surfaces for a long time. One of the things that I believe I heard was that the fear of transmission of the COVID virus off of physical,
Surface. Yeah.
surfaces, thank you, is much less than was certainly feared at the beginning.
Yes, that continues to be the case. It becomes much less infectious when it's hit with sunlight, UV light especially. It can be killed, quote unquote, or rendered non-infectious. But yeah, it's true. You don't get it. maybe a keyboard, maybe your cell phone, since we're so crazy about our phones these days, and we
hug them.
we play with them constantly, and use them constantly for good purposes, by the way. I'm sorry to castigate, but anyway, yes, those surfaces are a little bit more dangerous, but yeah, the average, surface is not a problem. But you see in hospitals, and I hope you all have noticed, when you visit a hospital, you see physicians and nurses who come into a room. The first thing they do is sanitize their hands, and they've incorporated this as an absolute standard operating procedure, and it is widely accepted as a procedure in places. You see the different products right at the entrance of stores or at Starbucks or a variety of places, and I think it's prudent to use those.
Great. If anyone else has a question at this point about the virus, please open up your microphone and ask it. Looks like
I just want to make a comment. Way back in March, I had an appointment at St. Michael's to get my vaccine, but I got a call from the senior center wanting to know if I was registered to get the vaccine, and if I wasn't, that they would let me come down there. And I want to thank you very much, Reed, for being on the ball and making sure all of us seniors who are registered at the senior center were being able to be vaccinated. So thanks, Reed.
Well, you're welcome. It was definitely a community effort. We had a number of people in the Medical Reserve Corps. Stephen, you might be able to talk about the widespread response that we've got from doctors and nurses who were willing to take extra time to administer those vaccines. And of course, the Bainbridge Island Community Pharmacy, which stepped up and said, we're going to do everything we can to get those vaccines available to go into arms.
Yeah, I can't really, the merits of those folks who showed up. I know they're busy with their normal practice, but they went way above and beyond. The current administration in Health and Human Services, HHS, is looking to bolster the whole Medical Reserve Corps because of what they saw, the response nationwide in the pandemic. And I wrote a letter and testified to the fact that I thought that was a very prudent step to congratulate and honor those volunteers, as well as boost the idea that gee, they've saved lives. And so, yeah, I think it's a wonderful organization, wonderful thing.
Yeah, and the city of Bainbridge Island did more than many cities, I think, in terms of providing for testing, making sure that there was available extra funding. And our local fire department certainly stepped in as well. So, I mean, that's just, there are a lot of people who helped, and that was one of the great things about that experience. Although it was scary and dangerous, it also showed that at least our community showed to be resilient. And I think that 90% inoculation rate is a testament somewhat to all those organizations coming together, which kind of gets me to the next topic I'd like to touch on briefly before we wrap up here, which is the idea of public health communication. And maybe definitely we had some, as you said, political headwinds that made it difficult for getting the medical information out. But I wondered if you saw anything that proved promising, maybe just like what we were just talking about, where people can be alerted to the importance of responding to a vaccine or other health preventative measures.
Well, CDC, for example, just changed their opinion about a booster for immunocompromised persons. So I think there are, I guess, how should I say this? The more flexible one is, or an organization is, especially at the high levels, like at a CDC or a National Institute of Health, the more flexible and facile they are, the better. If they feel highly politicized, then unfortunately, those political second guessings cause misinformation to come out, or hesitant information like, well, this could happen, but oh gosh, we don't know. It's better for scientists and science in general to just be honest and open, and not looking over their shoulder at a political maneuver, but to say, well, right now we don't have enough data to say, yes, we're going to need boosters, but it looks as though for those who are immune compromised in any way, cancer survivors or patients under treatment, it looks as though we're going to have the need for another shot, and to operate on that level of honesty and openness, which I don't want to get into a political thing here too much.
I think about, like, I know that a lot was made of Anthony Fauci's original statement that we didn't need masks, and then a later statement that we probably or really should be wearing masks as some sort of evidence of chicanery, if that's the right word, when in fact what was going on was that to some degree there was an interest in preserving masks for doctors and nurses, which maybe should have been what was said rather than you don't need one. And we learned more about the way the virus was being transmitted as it started to spread.
Yes, quite. That's so accurate. I also think that when one considers a statement from the Centers for Disease Control, I know Dr. Walensky is very articulate in when she gets in front of a camera, but I think CDC is relearning to be more openly communicative. If they say something today and they have to say something different tomorrow, well, science is dirty, Science isn't 100% down a straight path. Science goes off in tributaries and convolutions and rabbit holes until it finally decides, okay, this is the way we're going to go. And I think to openly discuss that, the American people we may be skeptical about government to some degree, but I think we'd rather hear what's going on as openly and candidly as the scientists could possibly be. I think that's happening at state and local government entities, state and local health departments. They really carried a banner during the last administration. They had no problem in speaking very plainly, whereas the larger institutions like NIH and CDC were hampered considerably during that time. So thank goodness for state and local health departments. But in addition, I think we're turning the ship around into the right direction at this point.
Great. And what you said about Health and Human Services looking to bolster some of those local
Yep.
resources will be invaluable, because I do think that although it is very important to have clear guidance from the top, nothing quite is as persuasive as what my neighbor or my doctor is suggesting that I do.
Absolutely, Reed. Yeah, that's a absolute key point.
So I want to thank you very much. Is there something else that you'd like to leave with us today? Very informative.
No, thank you for inviting me. I really appreciate the chance to chat and to hear the questions. It's fun, and I look forward to coming down to the center and face to face, giving you a hug. Oh no, wait! I'll just give you.
We have the hand sanitizer around, so we can
There you
handshake anytime.